the intervention that we chose to do with this patient was hip mobilizations, and because they are limited in their hip flexion and internal rotation, we chose to primarily focus on posterior mobilizations, because in open chain, when the patient goes into flexion, there's an anterior superior roll and a posterior inferior glide. And so we want to focus on treating the glide, and that's why we're doing the posterior mobilization. And I'm going to show you just kind of how we learned it in class, but we did learn, or I learned a unique way to do this using some Pilates equipment during my last clinical rotation, kind of helping to get a little bit more gapping or traction within the hip joint using the Pilates trapeze table, which I showed on the previous slide. But first, I'll show you just the way that we learned in class. So first, you'll get consent from your patient. Lamont, is it okay if I do some movements at your hip joint?
Yep.
Okay. And then I would take the leg and bring it up into 90-90 here, and then just clasp my hands and come right in to the hip joint. And then in a staggered stance, I would kind of go through the soft tissue. And again, to treat pain, we do grades 1 and 2, and to treat range of motion, grades 3 and 4. And then I would just sink back onto my back leg to help get that posterior glide with some traction. And then if I wanted to improve some of the internal rotation, I could shift my hands in and kind of work from there. And again, sinking through that soft tissue, feeling that R1 for the grade 1 and 2, and then for 3 and 4, sinking more back into that R2. And then the method that I learned during my previous clinical rotation was to have the leg supported from the trapeze table. And I'll kind of demonstrate it using a TheraBand. But we'd have the patient in what they call like an ankle wrap, and we'd attach it to the trapeze table. And so it would allow the patient to kind of get some distraction within their hip joint. And then that is attached to the trapeze table while we're doing the hip glides. And Becca also had done this quite a bit at their on our clinical, so she can demonstrate a little bit further. But that's it for hip mobs.